Okay. Good morning, everybody. This
conference will now be recorded.
Good morning. This is the virtual meeting for the Board of Health, Monday, May 18th, 11 a.m. All right. First order of business is approval of the minutes of April 28th, 2020.
Okay, make a motion to approve?
Second?
All in favor?
Aye.
Aye. Okay, and moving along, we will go to new business, update of COVID-19 response. Sagal?
Great, thank you. So before we get into my written report, which I can elaborate on, I just wanted to give Aubrey an opportunity to talk about some of the work she's been doing and some of the resources that are available for residents.
Thank you, Sagal. So I just wanted to remind the community that on the Impact Norwood website, impactnorwood.org, we have a number of mental health resources available for anybody in the community. We posted 5 webinars over the past few weeks, and all of those webinars are available on our website. They've been recorded. I'll highlight 2 of them. One is Teens, Tweens, and Quarantines, which was for parents on how to help their teens through this really difficult time, and another called Pandemic Parenting for grades K through 5, and that was how to help little ones cope with all of this. So those are all available on our website, and I just wanted to highlight those once again. So that's it for me. Thank you.
Thank you.
So I wanted to update the board on a couple of things. First, our case numbers. While we keep seeing an increase in the total number, we are seeing a decrease in our cases week by week. So I think that's a great sign. And most of those cases do tend to be in nursing homes and essential workers. So those are the people out and about that we expect to be in contact and be getting as positive cases. We continue to see a good amount of testing. We have the community testing program where any Norwood resident can get a test. We really encourage people that either have symptoms or have been exposed, so they are a contact of a case, to get a test. And the number to do that is to call the hospital at 781-278-4499. And you have to call and make an appointment and pre-register. It is appointment-based. And we always say, you know, the more we test, the better it is, because then we can identify cases, isolate them, and quarantine their contacts. And that's how we slow the spread.
Sagal, is the community utilizing that? Are we getting through?
We
Numbers?
The numbers actually are pretty low. The first week we only had 15 people. Actually, I think
Oh.
the first 2 weeks, yeah. So it hasn't been utilized that much, which actually shows that I think there is a lot of testing out there, and the people that need to be tested are going through their physicians or to urgent care and getting tests. So I know we keep hearing that we don't have enough testing. Testing is pretty widely available. If you have not had any contact or don't have any symptoms, a test doesn't really tell you anything. And actually, maybe I'll kick it over to you, Stacy, to sort of explain some of the new issues that have been coming up with serology testing and the difference between antibody testing and virus testing. Stacy, if you could describe that, that would be great.
Sure. So what we're seeing now is you probably hear this a lot on the news about antibody tests, and people want to know if they have antibodies. And what that is that's a blood test. So that's a serum blood test. It's not the swab that goes up your nose. So if you go and just get tested just out of curiosity to see if you have, some people want to know if they have antibodies. What happens is if it comes back positive, it doesn't tell us much. All it tells us that you may have been exposed at some point. You may have had disease at some point, but we don't know when. So what happens is if you just go and get that test, it comes back positive, we have to put you in isolation. And then we have to quarantine all your contacts. So if you do want to get that test, it's not that it's not a good test. It's early on in the game, and it's a new virus to us, so we really don't know how to interpret the serologies. A disease like measles, we've had decades to understand what it means to have antibodies for measles, but with coronavirus, we don't have that. So what we suggest is if you want to get this serology test, make sure you get the nasal swab at the same time. So that way, it at least gives us more information. So if you do have antibodies, and then you have a negative nasal swab test, that shows that you had this infection sometime in the past. And so we will not have to put you in isolation. But if you do not get that, the nasal swab, and you just go and get the antibody testing, it doesn't tell us much. So unfortunately, we have to err on the side of being very conservative, and we put you in isolation. So please, if you do go and get the serology test, make sure you get the nasal swab along with it.
Is this the nasal swab that goes up, way up your nose?
It goes up your nose. It's not that. But so I think, Joan, that's a very good point, because some people say, oh, I don't want that. I don't want that swab going up into my brain. I'd rather have a blood test. I would suggest you don't do that, or do both. Just you can get the blood draw, you can get the serology, but also get the nasal swab, just so we have a clearer picture of what's going on with you. And again, if that nasal swab comes back negative, you don't have to go in isolation, and then we don't have to contact all your family members and everybody you were in close contact with and put them in quarantine, which is what we're going to have to do if we see an antibody test that comes in. And those are starting to come in right now. And unfortunately, we have to put people in isolation. And that's guidance from the Department of Public Health. We go on, we have trainings with them every week, and they tell us that's what we have to do.
Okay.
Stace, for children, granddaughter broke her elbow. They tested her at Children's for COVID, but they did a mouth swab.
Yep.
Was that
This-
normal for children?
There's nasal swabs, there's all different types of testing. That's fine. You're going to start to
Okay.
see different things. You might even see people
Just so
poking-
parents would know for young kids that nasal swab, if they do a mouth swab, it's still a good testing procedure for them.
Right, because that's looking for the virus. That's looking for RNA on the virus, whereas the antibody test is looking for your immune response to the virus. And we don't know when that occurred. So that is a whole point. It just means at some point somewhere. We don't know if it's current or if it was from 2 months ago. Whereas a swab, that's more current because that goes away with time. So if you had a disease the month ago, hopefully now when they test you do a nasal swab, it's negative.
Yeah, but this was an oral swab, so, but that,
Yeah.
okay,
Yeah,
but it's
this-
still the same. Okay.
Yeah, that's a PCR. That's the one. Those are fine.
Okay, thank you.
I keep saying nasal swab just because it's easy to understand. It's actually called a PCR. It's a type of test that looks for RNA.
PCR. Thank you,
And
Stace.
The mouth swab might be so the children aren't frightened by it. They're a little more,
I'm sure.
it's a little easier for you to swab a child's mouth than to put anything up their nose. So that's probably why they did it by the mouth.
Adults too.
Thanks, Stace.
Thank you, Stacy.
So the next big phase is starting today. The governor actually speaking now about the reopening. So we've received a little information from the state about how that will be enforced. We will again be the primary enforcement agency, but we will be working with the State Department of Labor Standards. And actually, Michael Flanagan is in charge of that. And I don't know if anybody remembers his name, but he used to work at Norwood Hospital as their facilities and emergency preparedness director. So
Yeah.
he's great to see a familiar face there. And can reach out if we have questions. But so it'll be a joint effort between the Department of Labor Standards and local boards of health to enforce sort of the reopening guidelines and orders. Information was leaked out to the press, so I think we all got a little taste of it, what's going to happen, but we're looking at construction sites and manufacturing allowed to open, but they do have very restrictive guidelines and protocols that they have to follow to maintain social distancing, sanitation, hygiene requirements for employees. So all that will be enforced by the local health department in conjunction with the Department of Labor Standards. So they really want us working together and notifying each other as we get complaints. And we saw a little bit of that with the earlier orders from the governor that we were working with them, and they would send us letters to administer locally, things like that. So I'm hoping that goes smoothly. They did also go over some enforcement guidelines. Actually, they have a stepped approach. I want to pull it up so I will give it to you correctly.
That's phase 1, Segal, right?
This is all phase 1. So manufacturing, construction, all the existing essential businesses that are open will also need to follow these new restrictions and guidelines for their employees and workplaces.
Will they be posted for them? Well, their guidelines, how will they find them? How would a local manufacturing company that makes glasses, how would they find their guidelines?
We're expecting it all to be on the state website as soon as the governor is done speaking. None of it is available yet. Otherwise, we'd be sending it out. But we hope that'll be up there today. And then they will have, I think they said a week, don't quote me on that, to sort of have their guidelines, and then it will really be complaint based. We don't have to go out and inspect every facility before it opens, but we do have to respond to complaints, whether it be from customers or employees or wherever it comes from. Us at Department of Labor Standards will respond to those complaints and investigate. So it's a tiered enforcement where they wanted us to do a verbal consultation with the first violation, and then a written redirect is what they call sort of step 2. And then we can fine up to $300 3 times before escalating to the next level. So we were just discussing that on a call. And what we expect is similar to other fining structures we have. The first time we go out, we document the violation, it'd be a $100 fine, second time $200 fine, third time $300 fine. If it still remains out of compliance at that point, then we go to the cease and desist letter, and we have to go through the court system. Hopefully we don't get to that. Norwood's businesses have been pretty compliant, so I hope that continues. I think most things will be resolved in that first step, because most of it will just be either confusion or not understanding how the guidelines applies to your specific business. Because already, there was a whole slew of questions about enforcement, and it always comes down to the devil's in the details, right? So how does this apply to my business? How am I going to do this? So I think working with Department of Labor Standards and all of our staff, we always err on the side of educating first before enforcement. And I think that's what the state was reiterating with us with that guidance.
Did he give any hint as to what's going to happen on phase 2? What he was thinking about opening on phase 2?
Yes, phase 2, we will look to laboratory and life sciences, offices with a 25% maximum occupancy. That created a lot of confusion because it doesn't say buildings, it says offices. So for example, our office has, okay, I'm gonna need to do some math. Let's pick up an office of 10 people. 2.5 of them can come. What does that mean?
Yeah.
You have an office of 4 people, only 1 person can come. So it does, what if you have an office of 100 people, then 25 can come. So it's a 25% occupancy of the office, not the building.
Okay.
Car washes, exterior and self-service only. Hair salons and barbershops. I know people are really waiting for that one. That'll be next week. And that will be by appointment only. And again, all these industries are going to have to maintain strict guidelines on social distancing. So they're not just going to open a business as usual. Specific to barbershops and hair salons, they're going to open up as appointment-based only, and they have to maintain the 6 feet. They need to have hand washing facilities, hand sanitizer, face coverings, all those things. And that's all the details that we're still waiting to hear on.
So Isabel, you said, excuse me, you said phase 1, we got that. Phase 2 is going to open up in a week after. Is that how it's going to go? Phase 3, a third week? You said phase 2 will probably, hairdressing, barbershops, that's phase 2. And that'll start next week. Is that how soon they're going to open up in between phases?
You're right. Let me correct that. Both of these are considered phase 1 this week and next week.
Okay.
Yeah. So we don't know phase 2 yet. They're considering that they're doing phase 1 over 2 weeks. I think it's just semantics.
Phase 1 over 2 weeks.
But that's
Oh,
important.
okay. So this is, okay. So, but they will be next week.
Correct.
Okay.
Which I think makes honestly better sense, because that gives them some time to develop their plan. Each business has to develop and self-certify of a plan. That will be a template document from the state that we will see, I think, after the governor announces it. It should go up on the website today. And we will be sharing that widely, because every business will have to sort of self-certify that they have met these restrictions and guidance. And then let's say we do get a complaint, then we will request that document. Let me see how you self-certified. Let me see how you met these guidelines. And like I said, most things will be just educational.
They don't have to submit that prior to?
No, it's not actually something where they have to get approval from us to open. They have
Okay.
to follow the date guideline and the restrictions as far as social distancing and sanitation and hygiene.
Okay.
Would that include nail salons?
I think things like nail salons where it's very close customer contact, won't be for a while. I
Okay.
know they said barber shops, but no, nail salons were not included in that. Hair
Okay.
salons and barber shops.
So now my question is, would each phase take 2 weeks, 3 weeks to put in place and secure that for us to go to the next phase? We don't know that yet.
I don't think we know that yet. I think a lot's going to depend on the metrics. I think a while back they said it was sort of be 2 weeks, but I think if we suddenly see a huge spike after this phase, we're not going to go to phase 2 and we might go back.
Of course.
So a lot of it will determine on the data.
Dental offices and doctor's offices, just to gauge, so many people have questioned going back to the dentist, the need for restorative work. Do you have any gauge on that? That'll be the last, I would assume, with restaurants, just because of the severity of the droplets and the spray. And
I think there's been a lot of confusion on that, and
Yeah.
we did have that question today and didn't get a great answer.
okay.
Whether, because Nana, sorry, what's the term? I'm blanking on it. Elective surgeries they want to come back, and healthcare, they don't want people delaying their routine healthcare, which includes oral health. So I'm hoping that opens up soon. I think a lot of dentist offices are opening up today, and we don't know if they got different messaging than we got.
How would they open
because I
up
didn't-
today?
Yeah, I didn't see anything on that, to be honest. So there's confusion about oral health and dental offices.
I mean, if there's a guidelines, I would like to know the guidelines from my past history, because I could help several people get back up their feet, but I didn't think that was included in phase 1.
Well,
I think it remains a question at this point. I don't know either. I
Okay.
haven't seen anything.
will that be part of week 2 though, where they said lab, life science, and offices? Will it,
No.
is that considered part of that?
I don't think so. When they say offices, I think they mean business offices.
But
Yeah,
there's-
I think all this.
No
might be-
customer.
But what about lab and life sciences? That's what I'm saying. Are they considering, I don't understand what they mean by life sciences.
I don't either. We need to get detail on that. I mean,
Yeah.
this is what a lot of it's going to be, is questions back and forth.
Yeah,
I mean, when they reopened golf courses, it took us weeks to figure out exactly how to do that.
okay.
So that was just one industry that was pretty low risk because it's outside. So a lot of these, as we start implementing them, there's going to be a lot of questions. And we're
Mhm.
just going to do the best we can, go one day at a time, like we've done for the last 72 days.
Well, I know a lot of doctor's offices in town are doing virtual, so, or telehealth, so they may stay doing telehealth, because unless they actually need to see their physician for any reason, there's no sense in them having to go.
That's a great point, Kathy. And I think that applies to, if you can work from home, continue to work from home. If you can do telehealth, continue to do telehealth. As things open up, it doesn't mean that you have to. It just means you're allowed to. And we
Allowed.
talk about that with town hall on our morning calls, that even if we have the ability to open, if we don't need to, if we can function with people working from home, we should continue to do that.
So is the governor announcing this morning as we speak that the ban of quarantine is to stay home? It's been lifted? That's the basic-
No, I don't
that's-
think, there was never an order to stay home in Massachusetts. It was just a guidance. So some states have actual stay-at-home orders. Governor Baker never did that.
Okay.
Now I think it's a stay safer at home. So
Okay, so whatever
still
that
encouraging
means,
people.
and people go out of their homes for whatever purpose now?
It's still pretty restricted. You only go out when you need to. And there will be more people going out because more businesses are opening. But still, they don't want, a massive gatherings or anything like that. They're still going to stay to the 10-person limit on gatherings also.
I find some of this very confusing and defined, but I suppose, Sigal, as we go along, like anything else, they'll become, set in our minds, and we'll know what we should do.
Yeah, it is very confusing and it is very hard. And I think as we, like I said, as we try to do things, we'll start to develop those questions and hopefully get answers. Just on the call this morning, we had a whole slew of questions. I think part of it too is that there's nobody in local health on this advisory board. So when you're talking about the main agency that's enforcing this wasn't involved in the development of it.
So if
we
people are
know-
looking for questions in the community on opening, can we refer them to you?
Yes, that's me directly. You can call
Okay,
You call the health department, leave a voicemail, we will get back to you. And also we have email health@norwoodma.gov.
That's not gonna work. They want to talk to you.
And I
Thank
do
you.
get those messages. I will call people back. It just, people be patient and give me some time.
Thank you very much. I'm done.
Mr. Gal, any response to camps?
They said on the call this morning that we will be talking about camps and childcare tomorrow afternoon.
Okay,
We're eagerly
Town of
waiting
Norwood?
to hear. We'll be talking with the state, excuse me. With all local health, we'll be talking with the state about childcare, camps, and outdoor activities will all be discussed tomorrow. Tomorrow
Okay.
afternoon at 3:00, so probably nothing, no real information.
Does that
till
improve,
morning.
does that include our pools, the 2 pools in Norwood?
I would assume, yeah, with outdoor activities. I think that would include pools and
Yeah.
beaches and campgrounds, all those things.
okay. Okay, anything else?
Any idea about restaurants, Sigal? We are loaded with restaurants. We want to keep Angelo busy.
Yes, I think that'll be in definitely a later phase when you think about the interactions that happen when you sit down in a restaurant.
Yeah.
I
I
don't
think it's
expect that
working
for a
well for
while.
the, yeah. Okay.
So definitely takeout can continue. All the things that are happening now can continue.
Yep.
I'm looking for, they said, people ask questions about outdoor seating. We're not there yet, but we do anticipate that will be a condition. That will be a part of the guidance, is that we're hoping that we can do some outdoor seating to sort of increase the number of people that can go to a restaurant, because again, it's safer outdoors than in an enclosed environment.
Thank you.
Anyone else have any questions? Joan?
No, I think she answered them all.
Now, we're just looking for answers. No question.
Me too.
Yes, you too.
Okay. All right, so moving along, I think we forgot to put Angelo on the agenda. So before we talk about the fall food clinic planning, can we do the inspection reports?
Yes, and a lot of that was enforcement of the guidance. So sorry, Angela, go ahead.
Okay.
There wasn't anything on the report that I'd like to highlight, other than keeping busy with responding to complaints at essential businesses regarding non-compliance to the face covering that was issued a couple of weeks ago. All those complaints that you've seen on the report have been addressed with either the owner or owners of the establishment or the managers or regional supervisors on duty at the establishment. Also, the places I've physically been to responding to these complaints already have signage posted, whether it's at the door or at their desk, about the face covering requirement. I've also given them copies of the face covering requirement, copies of a signage they can also post in addition to what they already have. So most businesses have been very compliant, trying to work together on this, but thankfully no major issues to report in the field.
I noticed a new place in South Norwood. Is that whether it's the Golden Bull or it's in what Nick used to be Nick's?
I believe that's going to be a butcher shop. I do have the plan review on my desk.
Okay,
That plan review will be completed sometime this week
okay,
and be sent out to them. And there's another place opening across the street from there, which I also have a plan review for, which will be done this week as well.
okay, I just
What type of
noticed.
business,
But they are not
what type of
open.
business is that?
They're not
Angela,
open at
across
this
from the
point.
bull.
Across from the bowl is going to be like a vitamin shop, protein shake shop, a well-being shop, as she called it. So, but again, they're not open yet. So we're in the process of the plan review process to be sent out, reviewed and sent out. So
Okay, good. Okay. So any other questions for Angelo?
Angela, what happened to China-Rama? It closed for a while.
I haven't heard from them. If they're closed, that's obviously that's up to them if they wanted to close.
Okay.
Yes, a lot of businesses have closed, even though they're allowed to do takeout and delivery. But some of them have decided to close altogether. It all depends on the establishment and what, that's their choice. So
If they did choose to close, Do they have to be re-inspected before they open up?
Oh, good question, yeah.
Yeah, we're still working on that. We'll see. I mean, they're gonna have to do something in terms of filtration system for the ice machines, their water. So those are things that are gonna come out in the future. There's some of the guidelines that have come out during that phase. I believe will state what they need to do before they open.
Okay.
I'll try to get it to as many places as possible before they open.
Yeah.
But we're still brainstorming on how to tackle that once that issue comes up in terms of reopening these places that have been closed for a while.
Okay.
So I did get a call that China Rama was closed and now it's open. So I wondered if you knew about that. And
I
they're doing construction in there as they're open. So maybe you could just take a peek in there for me.
Sure, I could physically go there and take a look. Sure, I haven't heard that at all, but I will definitely do that. Sure.
Thank you, Angela. That's it. Thank you.
All right, moving right along. Fall flu clinic planning.
Really? Really?
Well, I'll tell you why I wanted to bring it up is because I wanted to have a little bit of a discussion about whether we thought we should do some of the COVID testing at the flu clinic.
Oh,
Yeah,
Jump
so,
right in.
You know, I think we'll wait and see what kind of testing is available at that point. I'm hoping, you know, who knows, as things change week to week. You see these drive-through tests. Are we going to do a drive-through flu clinic? Because we also have to worry about large gatherings and where we're going to be in the fall. Are we going to be able to do our flu clinic in a regular way that we usually do? Are we going to have to do it drive-through? Are we going to have to do it, you know, by appointment based so we can control the crowd? You know, we're not going to be able to get 20, 30 people in a room, I'm assuming, at that point, even in the fall. So I think we need to think creatively, and can we partner with some sort of testing program if people want it? I think we could, you know, sky's the limit, but we need to be creative to think about how we can do this in a safe way.
Yeah. Well, I just wondered if we still have, where it hasn't taken off hugely with the 1,000 testing kits that we have, that if we still have quite a few, maybe that would be a segue for people to come and get their flu plus do a COVID testing at the same time, if we can figure it all out.
Yeah, I think it's something we can talk about and try and figure out. I'm thinking if, I know in the drive-through clinics, they were talking about the patient has to be the passenger because it is a little traumatic to get a nasal swab, and that some people get a little woozy afterwards, just because of the experience. Not that it causes any, you know, loss of blood or anything. That they don't want people driving right after it. But you see a lot of the drive-through clinics, and they're working great. So, you know, that might be an option for us.
so we're assuming right now that our dental clinic, that these guidelines are going to stay in place, that a social distancing even in October. So we really have to plan ahead and take, you know, heed of this, right? That social distancing in large groups is still not going to be able to form even in October.
I would guess yes, that's true.
Okay.
Well, also a piece of that is we may have to look at PPE as well. For who's that? I mean, we usually have 8 nurses giving out flu vaccines. I don't think we'll necessarily need 8, but I don't know. And do we put them all in PPEs when they're doing this? I
And
guess
don't
so.
you have to change them for the next patient? For the next client? And that's costly,
Right.
Yeah.
right? You can't inject Stacy and you inject Seagal with the same PPE on.
No, I mean, well, I think this is some of the stuff, that's why I wanted to bring it up, because these are some of the questions we're gonna have to, you know, figure out before the food clinic heads, you know, and since we're usually off during the summer months, I don't wanna sit back, because if we do have to order some PPEs, we're gonna have to talk to Tony about that, about ordering some PPEs.
Yeah, and it's still
You're gonna need
matter-
N95s, Stace. Oh, hi, Tony.
Hi, Carolyn.
Stacy, would we need N95s for that clinic?
I think we're gonna have to wait and see because everyone's gonna be in the same boat. So I think there's going to be guidance, like Sal said, for across the board for flu clinics.
Okay,
But yeah, you have to protect the workers because you don't know who's coming in.
yeah. Exactly. Okay,
There's so much.
I just wanted to get it out there to people start thinking about it so that we can, so that all of a sudden when we're in October, we're not saying, uh-oh, we didn't plan on this, so. All right,
Yeah, for sure.
and the same with the next one is the hazardous waste day is gonna be September 26th. We have to come up with some idea how we're gonna do this as well.
Yeah, and a lot of that, the risk is more to our employees and our the businesses that we contract. For the residents, they're pretty much staying in their cars. There's very
Right.
low risk of exposure, but we need to think about the number of people gathering. It is outdoors, so that helps.
Yeah.
They also our company that we contract with has also contacted us about some creative ways that they're doing hazardous waste collection. Again, completely changing their model, like everything in our life is completely changing.
Yeah.
So that it's less person-to-person exposure. How can we do it in ways that don't have that human interaction? You know, some sort of drop-off or pickup program. So if we, and I think we have to make that call again closer to the September date, but
Yeah.
to keep it in mind, like you're saying, Kathy, that how are we going to do this differently to abide by sort of social distancing and gathering restrictions?
Plus, I'm not so sure that the pre-release people that we use, you know, are we gonna,
Oh, right.
we have
Yeah.
to test them ahead of time, or, you know, if they've already been tested, make sure that they've already been tested, take their temperature that day. It's fun, everybody to start thinking in their minds how we might possibly get this done. Because I got a lot of people were sad to not see it happen in May, but I was like, just not gonna happen. It just, it was.
So really think about, Joni has contact and I have contacted Kathy because we're up front asking for, it takes a minute. If you don't have a stick up, you can go. But most of the time, 50-50, they have to go through their card. They have to show me a light bill. They have to show me some kind of residency. So we are in contact with them for about 3 to 4 minutes, of 5 minutes of that. So that would be a consideration of
Yeah.
how we're going to bypass that.
Right. I mean, there's definitely gonna be more restrictions. Maybe you have to have a sticker, so you actually don't have
Yeah.
to have an interaction. We're
Okay,
not gonna
yeah.
be handing them a piece of paper anymore.
Right,
You know, I mean, maybe we don't even do it at the site. Maybe it's more of a pickup thing where, you know, we go house to house and people have to register. So I think we got to totally think outside the box and turn it upside down of a different way to do it. But I think, Kathy, you're right. We need to have it where we canceled May.
Oh, no, we need to have it.
September.
yeah. Yeah. People are already, I mean, people I know are already asking because they had wanted to be there for May, but unfortunately, that was just too risky to even do anything like that in May, so. Okay, all right. Before we go into old business, do you want to do the director's report, or did you give us everything you needed to say in the new business?
I put everything in new business, but I think we could update everybody. The public health nurse position closed on Friday. We'll be reviewing the resumes and hopefully interviewing realistically next week. And we'll see if the second round is, we remember we reposted after not being successful the first round. So hopefully.
How many
lots of good
applicants did we
candidates.
get the second round, Sigal?
About 15 to 20.
Yeah,
Okay, great.
Good. Good. Any good people or?
Yeah, some resumes looked interesting. I think I flagged about 4 or 5. And
Yeah,
then
Good.
Great.
me
Now,
as well.
Were they some of the same people that interviewed the first time?
no, just one repeat.
Oh, good.
The rest are all new, I think.
Okay. Good.
All right, director's report. So board's agenda. Carolyn, do you have anything?
No, Carolyn took care of it with about China Ramen. No, thank you.
She doesn't like
You know,
to
it's hard
wait.
to tell who Carolyn is out on the street anymore because we've got a hat on, we got a mask on, so it's
Joan?
good.
No, they asked everything that I had, so I'm pretty well.
Thank you.
set.
Okay. Stacy, do you
Just
have
want
any?
to say thank you.
Oh,
Nope, I'm good. I don't have anything.
okay.
Do you
And I
want to
started
set,
wanna say thank you. All right, knock it off.
sorry, I didn't know,
I just wanted to say thank you to Sigal and Stacy and the rest of you, and you too, Jen. You know, for all the extra hours and time and
Oh,
nerve
yeah.
and everything else. We truly appreciate it as a board. We really do. We might say it often enough, but we do appreciate it. Thank you.
Thank you.
Thank you.
That's
Thank you very much.
Okay, now Jen,
thank
now.
you. I just didn't know before going into executive session if you wanted to set the next date while we're still on air.
Yeah, that'd be a good thing. Do we want to do a meeting in June?
Well, I think we should with the
With
crisis
everything
going,
going-
pandemic.
That's going on? Yeah?
Yeah.
Okay.
I think it's a nice way to keep the community updated, you know, on what's available and what the next steps are and how we're moving along with it.
Do we also want to consider doing July and August because of this?
Let's not get pushy. We'll do one meeting at a time and see what happens in July.
But we can do it from our own home now, Joan. You're out. You just push a
Yeah.
button.
Yeah,
Yeah.
okay. All right.
I pick June 1st.
Mm-hmm.
Well, June 1st, that's only 2 weeks from now.
No. I said I'm sorry, pick a date in June now first. Let's pick a date in June. How about the 22nd or 23rd? Sigal, which days do you have meetings in the morning?
the 22nd would actually be better. We have,
20
yeah, we have a 9 o'clock every morning, and so anytime after 10.
We did 10:30. Is that good?
Good for me.
I don't care. I mean, you know, 10:30, whichever is good for you guys.
10:30, give them a little leeway.
Okay,
Yeah, 10:30 is fine. June 22nd?
which is what day?
Monday.
Monday.
Is Monday a better day for you, Sigal, or is Tuesday a better day?
Yeah.
Apologize. Someone
That's
walked in the room.
That's all right.
What was the question?
Is Monday or Tuesday a better day for you?
Monday would be better.
Monday. Okay, so June 22nd it is.
10:30, right?
10:30, yep. Aubrey, do you have anything to add?
No, I'm good. I said my piece at the beginning, but thank you for asking.
Okay. All right, so we're going to head into executive session. And I'm just going to read this. The purpose is to discuss strategy with respect to the pending litigation regarding the case Suresh Incorporated DBA Quickstock et al. V. Kathleen F. Bishop et al. Regarding regulation of the Norwood Board of Health, restricting the sale of tobacco products. Deliberating during opening session would have a detrimental effect on the pending litigation. We will adjourn from executive session. So I need to do a roll call vote for this. Carolyn?
Here.
Say
Yeah.
aye.
You have to say
Joe?
yes. No. Yes is fine.
Oh, yes.
Okay. And I'm yes as well. So we.
Where's the dog?
Sigal?
She had a little munchkin.
I'm cheering my children away. I apologize.
That's okay. We just had to do a roll call vote. So do you vote? I don't
No.
think you.
No,
No.
just the board.
Okay, so we're all set to go into, we took our vote. All in favor?
Aye.